Okay, let's go on to the next slide. I see a couple more people coming in, so I know that a couple people will trickle in as we go. Welcome. This is the ballot initiatives pros and cons presented by the San Mateo County League of Women Voters. Next slide, please. So this program will be interpreted in Spanish. To hear this forum in Spanish, you will click the interpretation logo on the right-hand side. Para escuchar este foro en español, haga clic en el icono del globo a la derecha. We can go on to the next slide. And to turn on the real-time transcription, click the More button on the bottom right to enable the live transcript. All righty. So, like I said, welcome. My name is Yahaira Ortega, and I'm the Policy and Advocacy Associate for Thrive. Thrive is the Alliance of Nonprofits in San Mateo County. We strengthen people, organizations, and communities through capacity building, cross-sector collaboration, and policy and advocacy. Let's move on to some of the programming that we host here at Thrive. So on Wednesday, October 26th, we will have our next Voter Education and Outreach Advisory Committee, VIAC, on Zoom. Everyone's welcome to come. This committee focuses on just having a place for folks to come by and share out and listen and learn to what's going on, all things voting in San Mateo County. We always have the elections office come in and give us some updates and a couple of different speakers. So like I said, everyone is welcome to join us. This is the last meeting before the November 8th election, and we are hoping to share any additional materials you can share with your communities. Next slide, please. Then Thrive, along with Silicon Valley Council of Nonprofits, will be hosting our second annual Racial Justice Summit. The theme of this year is Healing Justice. The summit is designed for the region's nonprofit organizations, leadership, staff, and board members to engage in dialogue about how to meet the promises made in the nonprofit Racial Equity Pledge. And if you scan this QR code, it will take you to the nonprofit Racial Equity Pledge. And if you're an individual, a board member, or even a nonprofit organization, feel free to check it out and see if you can make that commitment. This will be fully hybrid, and the dates are October 31st through November 3rd. And this is our Wellness Wednesday series for nonprofit staff. You are all invited to join us on November 16th. And we will explore techniques to de-stress and build resilience so that we can better connect ourselves and others. All righty, so I will hand it over to Kathy from the North and Central League of San Mateo County.
Well, thank you, Yahaira. And I am partnering with Linda Atkinson this afternoon to present pros and cons. And actually, Linda's going to start us off. So I'm going to do a share screen and get our slide set up and going. Go into presentation mode. Come on. There we go. And Linda, take it away.
Well, welcome to you all. As Kathy noted, I'm Linda Atkinson. I'm from the South San Mateo County League of Women Voters. And my colleague and partner is Kathy Wheeler from the North and Central San Mateo County League of Women Voters. Today, we will be presenting the pros and cons for the California state ballot measures that appear on the upcoming ballot for the November 8th, 2022 general election. But first, I will tell you a little about the League of Women Voters, give you some general information about ballot measures, or propositions as they're also known, and describe our analysis of the propositions. As many of you already know, the League of Women Voters was founded over 100 years ago in 1920. That was the year when women first gained their right to vote. Its purpose was, and still is today, to promote an active and informed citizenry for all genders and ages 16 years and up. The League of Women Voters does not support or oppose candidates or political parties. However, it does encourage informed and active participation in government. It works to increase understanding of major public policy issues and influence public policy through education and advocacy. These are two separate and distinct functions of the League. If you're not already a member of the League of Women Voters, we'd like you to join the League of Women Voters of South San Mateo County and North and Central San Mateo County, depending on where you live. You can do so by visiting the two websites that are shown on the screen. So what are ballot measures? Propositions are proposed laws presented to the public to vote on. Propositions can make laws, change existing laws, and sometimes they change California's constitution. Propositions can be placed on the ballot either by people who collect enough voter signatures on a petition or by state lawmakers, that is the California legislature. For a ballot initiative statute, the number of signatures must equal 5% of votes cast for governor in the state's last gubernatorial election. Currently, that number is over 600,000. But for a constitutional change, more signatures are required, and that is about over 900,000, almost 1 million signatures. A proposition that you vote on becomes law if it receives more than 50% yes votes. It's a simple majority. For a referendum, also a simple majority, if there are more yes votes than no votes, the law that it's referring to is sustained. If people vote no in the majority, the associated law is repealed. This is how the League does its analysis for pros and cons. We describe the current situation relevant to the proposed law and indicate what the proposition will change or do. We then present the Legislative Analyst Office summary of the fiscal effect on state government budgets. We deliver the stated arguments for and against the proposition. Then we follow the financial contributions by supporters and opponents. Here are some great questions to ask yourself about each proposition. Does the ballot measure address a real problem? Is this the best solution to the issue, or is it too complex? Who are the interested parties and what do they gain? What are the fiscal implications? We hope you find the answers to those questions. I'll turn it over to Kathy now.
Yes, let's get to the pros and cons. Our league would like to thank the League of Women Voters of the California Education Fund for the materials that make up this presentation. We will be showing a short YouTube video that was done by the California League for each proposition. While you listen, we encourage you to enter your questions in one of three ways. You can enter via chat, you can use the Q&A function, or after I'm done with the first proposition, you can raise your hand and we'll gather your questions that way. We'll take 1 to 2 minutes at the end of each video to answer your questions. So let's get to Proposition 1.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we're going to talk about Proposition 1. Prop 1 would amend the California Constitution to include a right to reproductive freedom. The question it asks is, should the California Constitution be amended to expressly guarantee the right to reproductive health care freedom, including the right to choose an abortion and to choose or refuse contraception? Currently, the California Constitution provides that all people have the right to privacy. A California Supreme Court case decided that the right to privacy includes a person's decision about whether or not to have an abortion. The Reproductive Privacy Act in California currently states that every person has a fundamental right of privacy with respect to personal reproductive decisions. So it is the law of the state that every person has the right to choose or refuse birth control, and every individual has the fundamental right to choose to bear a child or to choose to obtain an abortion. The Act also says abortions can only be performed on a viable fetus if the pregnancy puts the health or life of the pregnant person at risk. The U.S. Supreme Court's recent decision held that there is no right to abortion under the U.S. Constitution. This raised concerns about whether a future California court might overturn current California law to eliminate the right to choose an abortion and to choose or refuse contraception. So, Prop 1 is proposed to change the California Constitution to say that the state cannot deny or interfere with a person's reproductive freedom and that people have the fundamental right to choose whether or not to have an abortion and whether or not to use contraceptives. As far as its price tag, Prop 1 would have no impact on the state budget other than the costs needed to place the measure on the ballot. Supporters of Prop 1 say that it will enshrine the fundamental right to an abortion and the fundamental right to contraception in the California state constitution. They also say that doctors, nurses, and health providers agree that Prop 1 is necessary to keep reproductive medical decisions where they belong, with individuals and their healthcare providers based on scientific facts, not political arguments. Opponents of Prop 1 say that it is an extreme and costly proposal that allows unrestricted late-term abortions and punishes taxpayers. It's possible that abortion seekers from outside the state will swamp California resources. Opponents also say that women already have the right to choose under current California law. The recent U.S. Supreme Court ruling didn't and won't change this, so this measure isn't needed to protect women's health or their reproductive rights.
Okay, so we have a slide here concerning the current supporters and opponents of Proposition 1. Supporters include the committee that is entitled Atkins Ballot Measure Committee, ACLU of California, California Medical Association, Planned Parenthood, California Nurses Association, American College of Obstetricians and Gynecologists, the League of Women Voters, U.S. Senators Feinstein and Padilla, and supporters have spent a total as of early this week of $9.3 million. Opponents have spent around $70,000, include the Women for Reproductive Facts, no on Proposition 1, California Together, no on there's two committees, I'm sorry, Women for Reproductive Facts, no on Prop 1, and then California Together, no on Prop 1. Others include U.S. Representative Tom Campbell, the Republican Party of California, Conference of Catholic Bishops, Democrats for Life of America, and Knights of Columbus. And the source for this information is Ballotpedia as well as state sites. So we'll open up for any questions from the audience. And I don't have a view of, well, I guess I can get to chat. Nothing so far in chat.
There's a hand raised.
I see a hand raised. Please type in your question in the Q&A.
I'm okay with unmuting the people with their hand raised if that's the easiest way to ask a question. Any questions?
Yeah, I see the hand raised here.
Yes. Can you hear me?
Yes.
Yes, we can hear you.
I have two questions. One is, does Prop 1 influence access to other reproductive technologies such as IVF or other things that involve banking of sperm or eggs or anything in that arena? Does it affect access to those? And the second question is there any influence in kind of codifying this as a right? Does it also mean that anybody is required to pay for any services, whether it's contraception, abortion, or assisted reproductive techniques?
Good questions. I'm not sure about the first. I don't believe that there's anything in the language of the proposition concerning IVF or sperm donorship. Can you repeat your question on contraception?
Sure. So in applying this right to reproductive care, does that include the whole spectrum, including contraception? And does it have any mandate for people who pay for those services that they would be required to pay for these services that are rights?
So as I understand it, those are currently rights in California, and that this is a constitutional amendment, okay, concerning the action of abortion to the point of viability. So this does not affect any of the current laws concerning contraceptives and associated with it doesn't affect contraceptives because that's currently the law. Does that answer your question?
Thank you. Yes.
Okay. So we will go on to Prop 26.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we are going to talk about Proposition 26. Prop 26 would allow in-person roulette, dice games, and sports wagering on tribal lands. The question it asks is, should California legalize in-person sports betting, roulette, and dice games at tribal casinos? Currently, California allows the California Lottery, card rooms, betting on horse racing, and gambling in American Indian-owned casinos in California. However, dice games, Nevada casino-style gaming, and betting on sports events are all illegal in the state. If passed, Prop 26 would allow tribal casinos to run roulette and dice games. On-site sports betting for people aged 21 and older would also be allowed in tribal casinos, as well as the state's 4 privately operated horse racetracks. It would impose a 10% tax on net sports betting at racetracks. The tax revenue would go to a new fund created by this prop. Any tax revenue left after deducting costs for the regulation of in-person sports betting would be divided to send 70% to the state general fund, 15% for programs dealing with gaming or mental health research, then 15% to the Department of Justice for enforcing gaming laws. Tribal casinos who wish to offer sports betting under Prop 26 would be required to renegotiate their agreements with the state to specify minimum payments they would need to make to the state, and whether those payments would go into the new fund created by Prop 26. If the payments do not go into the new fund, the proposition requires tribes to at least pay the state for the cost of regulating sports betting at tribal casinos. Prop 26 would also allow a person or entity who is aware of violations of the gaming law to file a civil action if the California Attorney General declines to act. Any penalty assessed in a civil action goes to the new fund. The fiscal effects of this prop are hard to predict, since much of it depends on the terms of the agreements between the casinos and the state, and on how much people who play the games or bet on sports will spend. The increased state revenues from tax payments made on sports betting at racetracks and civil penalties for gaming violations could potentially reach tens of millions of dollars yearly. The increased costs to enforce and regulate the new betting could potentially reach the low tens of millions of dollars each year. The state would also incur expense for enforcing certain gaming laws, and costs related to that are not likely to exceed several $million each year. Those who support Prop 26 say it would continue the 20-year legacy of allowing closely regulated gaming to support American Indian economies. They also believe it is the most responsible approach to authorizing sports wagering, and it would promote American Indian self-reliance. Its opponents say that Prop 26 would massively expand gambling in California for the benefit of large tribal casinos. It would leave casino workers unprotected from worker safety, wage and hour, harassment, and anti-discrimination laws. They say that gambling is addictive and that legalizing more gambling is bad for public health. We hope that this.
Okay, so supporters and opponents of Proposition 26. The supporters have spent as much as $122 million. The official committee is Coalition for Safe, Responsible Gaming, sponsored by the California Indian Tribes. It's supported by 31 California tribes, 19 city and county Democratic Central Committees, the Indian Chamber of Commerce, and the Peace and Freedom Party. The opponents have spent upwards of $43 million. The committee is the No on 26, Taxpayers Against Special Interest Monopolies. They include the Republican Party of California, Election Entertainment Group, Hawaiian Gardens Casino, Hollywood Park Casino, United Ventures LLC, the California Animal Welfare Association, the California Black Chamber of Commerce, and the Mercury News and East Bay have both written editorials. And again, the sources are Ballotpedia. So I will look to see if we have any questions. Looks like there's a question. Is it factual that employees of tribal casinos do not have the usual protections from discrimination, harassment? I cannot answer that question. I don't know whether that is a yes or a no. Linda, do you have any response to that question?
I do not know the answer to that. I suspect that they have various policies implemented according to tribe, and so I just don't have any information on that.
Another response is federal law perhaps does not apply on tribal land. I assume this is regard to discrimination, harassment. I will make note of this particular question. It's a good one, and see whether I can get the information back to Thrive for follow-up. Another question, expands betting only at casinos and racetracks? That is correct, and these are Indian casinos, which are the only legal casinos in the state. Does not apply to card rooms. Is there anything in chat? No. Are there any hands raised? Any more questions on this one? Else we will go to 27. And of course, if a question occurs to you and we've already talked about a proposition, there's no reason why you can't ask a question about a proposition we've already talked about. Okay, we'll go to 27.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we are going to talk about Proposition 27. Prop 27 would allow online and mobile sports wagering outside of tribal lands. The question is, should California allow online and mobile sports betting for people aged 21 years and older? Currently, California law allows the California Lottery, card rooms, betting on horse racing, and gambling in American Indian-owned casinos. Dice games, Nevada casino-style gaming, and betting on sports events are all illegal in the state. The rules governing American Indian-owned casinos are set by individual agreements between the owner tribes and the state of California. Prop 27 would allow adults 21 or older to bet on adult sports events online. Tribes could offer online sports betting under the tribe's name and branding. Tribes would have to pay a one-time $10 million licensing fee to the state and a renewal fee every 5 years. Gaming companies could also offer online sports betting if they strike a deal with a tribe to operate in California and pay a one-time licensing fee of $100 million plus a renewal fee every 5 years. A new division within the state's Justice Department would be created to regulate online sports wagering. The proposition would also impose a 10% tax on all companies or tribes offering sports betting. The tax is imposed on a gross amount of the betting minus the amount of money paid out to winning bets, promotional offers, and federal gambling taxes. After paying the state's regulatory costs, revenue from the tax and the licensing fees would go into a new fund. Of the money in that fund, 85% would be used for homelessness and related mental health programs, and 15% would go to American Indian tribes that are not involved in sports betting. So, what are the fiscal effects? The size of Prop 27's fiscal impacts depends on variables such as the number of entities that offer online betting, the renegotiation, if any, of tribal agreements with the state caused by offering online betting, and the number of people that engage in online betting. There is a potential for an increase in state revenue, reaching from the hundreds of millions up to $500 million each year. There will be increased regulatory costs, estimated to be in the mid-tens of millions of dollars each year. Some or all of these costs would be offset by the payments sports betting operators must pay the state for regulation. Prop 27 supporters say this measure will provide hundreds of millions of dollars to support programs that alleviate homelessness, mental health, and addiction in California. It will benefit every California tribe, especially rural and economically disadvantaged tribes which don't own big casinos. Its opponents say Prop 27 is a deceptive measure promoted by out-of-state companies to legalize online and mobile sports gambling in California. And online gambling is not a solution to homelessness or other social ills and will open more people to gambling addictions. We hope that this...
Okay, supporters and opponents. Supporters, and money has been spent to the tune of $69 million. Committee is California for Solutions to Homelessness and Mental Health Support. Other supporters include the mayors of Fresno, Long Beach, Oakland, Sacramento, 3 major bands of American Indian tribes, Major League Baseball, and other supporters include online. These are 3 online sports betting companies: BetMGM, FanDuel Sportsbook, and Crown Gaming. Opponents have spent $214 million. They include committees Californians for Tribal Sovereignty and Safe Gaming, Coalition for Safe Responsible Gaming. Others include 50 California Indian tribes, the California Teachers Association, the California Democratic Party, the Republican Party of California, the Peace and Freedom Party, and Communication Workers of America. And so far, who put this on the ballot? Was that a question of 26 or 27? Linda, do you know who put it on the ballot?
Prop 27 was put on the ballot by an agreement, I think, between 3 tribes or 5 tribes who are not involved in the other casinos and the online sports betting groups, the large companies.
Okay, so it was clarified. So the question applies to 26 and 27.
Yeah. And 26 was put on by the tribes that are supporting that expansion.
Okay, I have another slide here that compares 26 and 27. This might be helpful to people because I've been asked this question. So both require a change to the California Constitution. 26 allows in-person sports betting at horse racing tracks and tribal casinos. And 27 allows tribes and gambling companies to offer online sports betting. So in-person versus online. Both seek to monetize sports betting. 26 restricts to in-person betting, racetrack or casino betting, and also adds roulette and dice games at the existing Indian casinos. 27 is online sports betting provided by tribes and gambling companies. Both set up special funds to mitigate gambling problems. 26 revenues from 26 would go into a gambling addiction enforcement cost program, a gambling addiction program, and then also reimburses the state for enforcement. Anything left over would go into the general fund. And then 27 funds homelessness projects and gambling addiction to the tune of 85%. And then 15% goes to excluded tribes who do not currently have casinos. Both increase gambling availability if either one or both are passed. So let's see if there's any extra questions. There are. What is the league's position on 26 and 27 and why? The league's position is neutral. They have not chosen to support or oppose 26 and 27. And they generally don't, I have that information right here and I'll double check if they actually have.
I believe they're neutral on both.
They're neutral on both and they don't, they have actually, I will not say neutral. Officially, they have no position. And as such, they don't have any written summary of their reasoning. I want to ask how many, few I suspect, tribes would have 100 million to participate. There are what they call the big five that have the large casinos, and that those five are the tribes that are in support of 27. Is that right? No, 26.
26. Yeah.
26. So that's a good question. Basically, I'll just say that the big casinos support 26. How do 26 and 27 compare in terms of benefiting all tribes? Currently, so 27 does try to fund excluded tribes, as it says here. So 15% of the special fund would go to excluded tribes. So it is, you could consider it to be more inclusive. I guess that's mostly what I would say. Linda, do you have any additional?
I would just say that any tribes involved with either proposition, should it become law, will receive some benefit from it. How much that benefit is pretty murky because you don't know how much people are going to bet. You don't know how much the different proposals will pay out. But at the end of the day, there will be some money going to the tribes.
So there's a question that follows that. What are estimated amounts of net revenues from either 26 or 27? In general, they have, we need somebody to mute. I'll mute. Okay, 26 is generally considered to generate in the tens of millions, and 27 potentially as much as 500 million. Again, it is totally dependent upon, you know, how popular online sports betting is versus in-person sports betting. Have any
Kathy,
other state?
If I may make a little comment on my own, the California Constitution was changed to accept a California lottery, and people voted for it because it was going to put a lot of money into the schools. Today, that totals about 1% of the school budgets. So it's really hard to project how much money is going, you know, to come out of this and go into the designated areas.
And maybe that's, and to add to that, is to again mention them that 26 will fund the general fund, which is where education money comes from, whereas 27 will not. Okay, it goes into special programs for homelessness and gambling addiction.
Kathy, before we
yes.
go on to the next question, we had a hand raised for a little bit. Mara, you can ask your question now.
Sure. And I think
okay, I can, sorry, I just unmuted. Just curious as to know, like, what percentage of other states allow this? Is California in the minority of states that regulate the gambling? I don't know.
yeah, so I actually have, I don't know whether I'll be able to find that quickly or not. There are many states that allow online sports betting, many being 10 or more. And I have it. I'm just looking to see whether I can find that information quickly. Probably not.
It's more than 10 and less than 20.
Yes.
Um,
So it is, and of course, Nevada is famous for it.
yeah.
Right. Thank
But
you.
all of that online sports betting happened after the Supreme Court ruled that the states could not control that. The other thing to point out here, in terms of similar, we have to change our constitution in California in order to allow these bettings, because since casino betting is not allowed in California, you have to have compacts between sovereign nations, which is the state of California and the tribes. So that's why it's very, very complicated to get any kind of betting going in the state.
Okay, so I found the information. Approximately 35 states have legalized such betting in one form or another. Quite a few more than 10. Not all states have operational betting at this time. Oregon has had on-site and online sports betting since 2019, with one company running the online sports betting, and Arizona started in 2021 with 3 vendors. To answer that question.
Thank you.
Anyone know why big casinos don't share revenue with the smaller ones? Can they work out an agreement? I do not know the answer to that.
I think that's internal tribal politics.
Right. And then what % of each prop's revenues are going into their respective special funds? And what % of each prop? So 26 is dependent upon current agreements of the Indian casinos with the state and the racetracks. 10, I believe it's 10% goes to 10% goes to regulation. But basically they pay for regulation. And then the online sports betting has special funds, okay, and it goes to these programs. Is there any evidence that money from gambling is helping the tribes? Well, there's a very good question. I would urge you to do some research on that. I think that that is probably a controversial topic. Okay, I think we will go on. Not seeing, there's no more raised hands, so we'll go on to the next proposition, which is Proposition 28.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we are going to talk about Proposition 28. Prop 28 would provide additional funding for arts and music education in public schools. The question it asks is, should California set aside specific funding for arts and music education in public schools? In 1998, voters passed Proposition 98, which amended the California Constitution to require a minimum percentage of the state budget to be spent on education, specifically kindergarten through two-year community college. However, there's currently no guaranteed source of annual funding in the state budget for arts and music education in K through 12 public schools. Even with no guaranteed source of funding, schools must fulfill state law requirements for arts and music education. Schools are required to provide arts and music instruction to all students in grades 1 through 6. Also, in order to graduate, high school students must complete a year in one of 3 courses of study, one of which is arts and music education. Prop 28 would require an additional portion of the state's general fund to be set aside to pay for arts and music education in K through 12 public schools. It would require the funding for arts and music education to be at least 1% of the funding received by schools the prior year under Prop 98. To address equity issues, schools that serve many low-income students would be allocated more funding under this measure. It would require schools to report how the funds were used to directly benefit students. And for larger schools, it would be necessary to spend 80% of the funding to employ new staff and 20% on training and supplies. When we look at costs, Prop 28 would increase state expenditures by about $1 billion per year for schools, over and above the existing constitutional requirements. Supporters of Prop 28 say that arts and music education can improve a student's personal and academic life, but only 1 in 5 schools has a dedicated teacher for arts and music programs. And ultimately, Prop 28 does not raise taxes. While no arguments in opposition to Proposition 28 were filed with the Secretary of State's, opponents of Prop 28 say that the measure will limit the state funding available for other spending.
Okay, supporters include the committee Yes on 28, Californians for Art and Music in Schools, with endorsements from the California Teachers Association, the Peace and Freedom Party, Austin Butner, former superintendent of LA Unified School District, and Arnie Duncan, the former U.S. Secretary of Education, with approximately $9.3 million spent. Opponents, again, there's no organized opposition, no noticeable money has been spent on this proposition, and the Mercury News and East Bay Time editorials oppose. Okay, questions? What? Nope, that's from last time. Besides art and music, what are the other 2 or 3 required courses to graduate from high school? I think there's a language requirement. That's a good question, but it's been a while since I was in high school. There's usually a language requirement. And then there's academic requirements. Anybody know the answer to that?
I think there used to be a PE requirement too. I'm not sure if that exists anymore.
Right.
Anyway,
And then there's a question about why the Mercury News and East Bay Times oppose. And basically, it is just because of bad economic times, bad timing is what I understood. I've not actually read the editorials. It was summarized to me. They are online if you're interested in taking a quick read. Would this have a positive effect on poor school districts who many do not have private funding for these activities? Yes, and I believe that is one of the core impetuses for this particular proposition is to make it an equal playing field for schools getting arts and music education. Many schools fund, for those who don't know, many schools fund art and music education through parent funds. Okay. Basically parental donations. Any other questions? Any raised hands? Not, we'll go to the next one, which is Prop 29.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we are going to talk about Proposition 29. Prop 29 would require an on-site medical professional at kidney dialysis clinics, among establishing other state requirements. The question it asks is, should outpatient dialysis clinics be required to have a doctor, physician's assistant, or nurse practitioner on site when patients are being treated? And should they be required to provide patients and the state with various clinic-related information? Currently, California's chronic dialysis clinics often operate 6 days a week for extended hours. They are federally required to have a medical director who is a physician and must report infections related to treatment to a federal agency. All patients have their own physicians who they must see once a month. About 90% of patients on dialysis are covered by state programs like Medicare and Medi-Cal, which pay a fixed rate for chronic dialysis clinic services. Other patients covered by group and individual health insurance plans often pay multiple times more because their rates are negotiated with each insurance company. After a period of time, all dialysis patients are covered by Medicare. Proposition 29 would require that a licensed physician, nurse practitioner, or physician assistant be on site at all times during dialysis treatment, who would be required to have at least 6 months of experience in kidney care. And if no such person is available on site, telehealth may be used for up to 1 year. Patients also must be informed of any physician with more than a 5% interest in the clinic, and patients cannot be discriminated against based on their source of payment. Prop 29 would require clinics to report to the state about dialysis-related infections among their patients. There are fiscal implications for both clinics and state and local government if this passes. The clinics would probably have to pay hundreds of thousands of dollars more annually for staff salaries. State and local governments might have to pay tens of millions of dollars more annually if clinics close and patients must go to more expensive facilities such as emergency rooms, or if clinics negotiate higher reimbursement rates. Those in favor of Prop 29 say requiring a physician, nurse practitioner, or physician assistant to be present during a dangerous procedure like dialysis is common sense and a matter of patient safety. With dialysis clinics currently facing fewer inspections than other health facilities, deficiencies are often uncovered. The big corporations operating dialysis clinics can easily make the required staffing changes and still profit hundreds of millions of dollars a year. Those against Prop 29 say clinics already use specially trained technicians, and every patient is under the care of their own kidney doctor, so more oversight is unnecessary. This measure would take thousands of skilled medical staff from hospitals where they're needed and place them in administrative jobs. And on-site administrators who don't provide patient care would cost hundreds of millions every year, forcing clinics to reduce hours or close. We hope that this summer.
Okay, supporters of Prop 29 have spent around $8 million. Includes the committee Californians for Kidney Dialysis Patient Protection. Others include the SEIU, the United Healthcare Workers West Union, and the Peace and Freedom Party. Opponents have spent $86 million. The committee is called Stop Yet Another Dangerous Dialysis Proposition. They include DaVita Incorporated and Fresenius Medical Care, two largest dialysis businesses in California. Also the Republican Party, American Academy of Nephrology Physician Assistants, California Medical Association, the California Taxpayer Protection Committee, the National Hispanic Medical Association, and the California Chamber of Commerce. And I have an additional slide here. You may be asking yourselves, have I seen this before? Well, yes. So on 2020, you saw Prop 23, which was the Dialysis Clinic Requirements Initiative. And it required dialysis clinics to have an on-site physician while patients are being treated, report on dialysis-related infections, obtain consent from the state before closing a clinic, and no discrimination against patients based on source of payment. And it failed with 63.42% of the vote. In 2018, there was California Prop 8, similar to 23, and it failed with 60% of the vote. So what's new here? So what's new is the requirement for reporting ownership interest in each clinic and use of telehealth when staffing is not available. So questions? There was a question, let's see. So I'll go back to the questions on 28 here in a second. Have there been health issues with dialysis clinics? That data is actually available online if you're interested in looking up. But when I checked it out a couple of days ago, nothing significant. Is there a problem being addressed? If so, what is it? I believe this would be my anecdotal summary, but basically they're saying that for a complex procedure, everyone should have access to immediate medical expertise. So they're basically saying that, you know, a doctor by telehealth or physician's assistant needs to be present during such a complex procedure. Why is regulation of dialysis on the ballot at all? Voters are not physicians, nor are we in a position to make decisions on health care requirements. Basically, enough signatures were accomplished to put it on the ballot. I think that's the easiest way to answer that question. I don't understand how it failed with 63% of the vote. Does it need? No. So 63% of the voters voted no on it, is what that means. So 63% of total votes were no. I hope that explains it. So it needs a 50%. It needs to have a majority to fail or to pass. Many dialysis patients can do their own dialysis at home, so that's information. Does this measure include increased reimbursement to cover costs of additional medical support? No, the cost of implementing this proposition would be on the companies providing dialysis.
And they would probably, if I may interject, they would probably raise their rates with Medicare.
Okay, so going back, someone provided what the high school education requirements are.
Oh, Kathy, excuse
Yeah.
me, there's another question after that one.
Okay. What staff currently administers dialysis clinics? I believe it's dialysis technicians. There's always an expert, a technician available at a clinic. And normally there are physicians on call. Aren't clinics usually affiliated with some medical oversight in order for insurance reimbursement? Oh gosh, I'm not an expert on that, so I'm not sure that I can answer it accurately. Okay, I'm going to go back to, someone asked for Proposition 28, which is to divert funding to arts and music education. Where does the additional billion funding come from, please? Well, it comes from state revenue. So it is not an additional tax. It would divert funds. It would create mandatory funds in the budget. Okay. And which means that something else would not get that money.
Also, may I add something? So it's kind of tricky because the 1% of the Prop 98 budget that goes to schools is calculated from the preceding year. So if you have a boom year, like this year, where there's like a $57 billion surplus, and so the Prop 98 is fully funded. If you have a downturn next year and the budget is tighter, you're taking money, you're taking whatever the 1% is of this year's budget and taking that out of the next year's budget, which may be tighter. So there's a problem in terms of how much money you're taking out each year and whether the budget is tight or not and can sustain that.
But that goes across all programs and take from the general fund, take from the fund. So I am going to go, I'm not seeing any new questions for 29, so I'm going to go to 30. Okay.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we're going to talk about Proposition 30. Prop 30 provides funding for programs to reduce air pollution and prevent wildfires by increasing tax on personal incomes over $2 million. The question it asks is, should California increase the income tax rate for individuals earning more than $2 million and dedicate the generated revenue to support increased use of zero-emission vehicles and wildfire suppression and prevention programs? So let's talk about the current situation. California is experiencing severe drought, increasingly devastating wildfires, and poor air quality. Gas-powered cars and wildfire smoke are the two largest sources of greenhouse gas emissions in the state. State law requires California to reduce its greenhouse gas emissions to 40% below 1990 levels, and that ride-sharing companies like Lyft and Uber have 90% of their drivers using zero-emission vehicles by 2030. But zero-emission vehicles, like electric and hydrogen-powered cars, are not affordable for many residents, and the state does not have enough charging and fueling stations to support increased use of zero-emission vehicles. The state recently committed to spending $10 billion over the next 5 years on zero-emission vehicles, and on average, it currently spends $2 to $4 billion a year on wildfire response. Prop 30 would increase the income tax rate by 1.75% on every dollar of individual incomes over $2 million. The increased revenue would be divided up with 45% of funds to help people, businesses, and government buy zero-emission vehicles, subsidies and rebates for cars and medium-sized and heavy-duty vehicles like trucks and buses can be funded with this. 35% of the funds would increase the availability of zero-emission vehicle infrastructure, including electric charging stations close to single and multifamily dwellings. At least half of the funds allotted for zero-emission vehicles and their charging must primarily benefit low-income and disadvantaged communities. And 20% of the funds would go to wildfire suppression and prevention. Hiring and training additional firefighters is a top priority use of the money. The tax increase would be in effect for 20 years, ending in 2043, or earlier if certain goals for reduction in greenhouse gases are met. Which leads us to take a look at the fiscal effects of this proposition. Prop 30 would generate $3.5 to $5 billion in revenue in most years, increasing over time. That would amount to $2.8 to $4 billion annually in zero electric vehicle funding and $700 million to $1 billion annually for wildfire response. The measure could help decrease state and local costs for wildfire suppression and prevention, but the size of the fiscal effects are a little bit difficult to predict. Supporters of Prop 30 say that greenhouse gas emissions from cars and other transportation are the largest contributors to climate change, and we need to take action now. They say that Prop 30 would make electric vehicles more affordable and would create well-paying green jobs. They also say that this measure would fund critically needed programs to prevent catastrophic wildfires and protect homes. Strict accountability would ensure that these funds are spent as intended. Opponents of Prop 30 say that if these projects are really important, they should be paid for with the state's general fund, not new taxes. They also say that California is already spending more than $50 billion for a multi-year climate investment, including $10 billion for zero-emission vehicles, and that this measure doesn't guarantee that zero-emission vehicles will be affordable for most California families. Opponents further say that money from income taxes will be locked into special interest, reducing money available for other uses like education. And finally, they claim that ultimately Prop 30 is Lyft's attempt to get taxpayers to help foot the bill for the requirement to increase the number of zero-emission vehicles in use.
Supporters include the committee Yes on 30, Clean Air California, Yes on 30, Working Families and Environmental Voters to Expose Greedy Billionaires and CEOs, and California Environmental Voters Issues. They've spent upwards of $37 million. Others include CAL FIRE Local 2881, the California Association of Electrical Workers, California Environmental Voters, Lyft, and the California Democratic Party. Opponents spending about $12 million include the committee No on 30, Gavin Newsom, the California Teachers Association, Howard Jarvis Taxpayers Association, the California Republican Party, and the California Chamber of Commerce. So let's see, we've got something in the chat. Okay, that is not a question. Okay, so far no questions. Are there any hands raised?
No hands raised, Kathy.
No hand. And Yahira, the answer to your question is I can continue. Okay, so I'll give it another 5 seconds or so to see if a question pops up. But we can go to the next. Oh, here's one. I read that the bulk of the supporters, 37 million, comes from Lyft. Is this correct? Yes, that is correct. And in your California voter information guide that came in the mail, they have links to the state sites where you can actually look at the reported money for these propositions, where it's getting spent. And that is the most up-to-date information. Ballotpedia is also very good. So if you want to see who exactly is spending the money. Okay. Now we'll go to 31.
Welcome to the League of Women Voters of California Education Fund video series explaining the 2022 statewide ballot measures. Today, we are going to talk about Proposition 31. Prop 31 is a referendum on the 2020 law that would prohibit the retail sale of certain flavored tobacco products. The question being asked in Prop 31 is, should the law enacted by the California legislature to ban the sale of certain flavored tobacco products be approved? The California state legislature passed a law in August 2020 that bans the sale of all flavored tobacco products in all stores and vending machines. That includes pods for vape pens, tank-based systems, menthol cigarettes, and chewing tobacco, but it does not include premium cigars or hookah tobacco. The law did not go into effect because a petition to demand a referendum on the law qualified for this ballot. And when a referendum on a law qualifies for the ballot, the law does not go into effect until the voters decide to approve it. If the law is approved, in-person stores and vending machines will not be able to sell most flavored tobacco products and tobacco product flavor enhancers. Premium cigars and hookah tobacco would not be affected. It creates a $250 penalty per violation for store and vending machine owners. So what are the projected fiscal impacts? Overall, allowing the law to go into effect, voting yes on this measure, would decrease state tobacco tax revenues in an amount ranging from tens of millions of dollars annually to around 100 million annually. The wide range in the estimate is because the response by tobacco consumers is uncertain. It's possible they will buy other forms of legal tobacco, in which case tobacco revenue won't decrease by much. Any impact on state and local government healthcare programs is unknown. Given that the proposition could result in both healthcare savings from better health due to not using tobacco products and increased healthcare costs for state and local governments when people live longer, the resulting long-term change in state and local government healthcare costs is uncertain. Supporters of this proposition say that Prop 31 will help decrease smoking rates, especially among youth. This measure protects our youth by ending the sale of candy-flavored tobacco products that lures them into lifelong addiction to nicotine. They also say that after targeting African Americans for decades in menthol cigarette marketing, this measure prevents big tobacco from causing more harm to Black communities that buy menthol-flavored tobaccos. Opponents of this proposition say it is simply a prohibition of tobacco sales to adults. It will drive more tobacco sales into the illegal market that already exists. They say that this proposition goes too far in banning some products the FDA allows, which will cause people to buy other tobacco products that are more harmful. We hope that this.
Okay, so supporters for this one include yes on Proposition 31, Committee to Protect California Kids, American Lung Association, the American Heart Association, SEIU California, Campaign for Tobacco-Free Kids, California State PTA, Democratic Party, and California Teachers Association. Opponents, and this is where the bulk of the money is 23 million. No on 31. Californians Against Prohibition include RJ Reynolds Tobacco, Philip Morris, ITG Brands, Swedish Match North America, National Association of Tobacco Outlets, Howard Jarvis Taxpayers Association, the California Coalition for Fairness, And I would like to repeat, this is a referendum. So if you want to ban the sale of this type of tobacco product, you would vote yes on this measure. If you want them to sell tobacco products and vending machines, then you would vote no. Right, Linda? I get it right?
That's it.
There was another one 2 years ago that was similar. It was like, yes is this and no is that.
Yeah.
Okay, so let's see if we've got any questions. Why not ban all or any tobacco if health concerns are impetus? Good question. It could be the subject of a new proposition. Basically, someone would have to get enough signatures to actually ban all tobacco products in California. There was another question. Sorry, I was late. Do all these yes, no on prop committees hide who is really behind those funds? Hide behind these funds. They're a consortium, I guess is the way to think about it. There's plenty of places to go look and find out who is representing these committees. So I don't think it's fair to say hide, but you do have to make the effort to go find out who they are.
And Ballotpedia lists all the major donors. So you can see who on each of those committees has put money into it, whether it's a person or a company or whatever. I think that California has laws that these things must be transparent.
Correct. So you can find out. It's just that, for instance, in the materials you get for voting, they actually do, so I won't say what I was going to say. They actually do list who is supporting and opposing the measures as far as what is known for when they print it. And it's printed, it's basically compiled and printed, okay. I got mine almost towards the beginning of September, so it's pretty early. So it's always good to go back. Ballotpedia is a great place, and review who else has gotten on the bandwagon for supporting and opposing. It's also, it takes them a while to compile all the monies being spent. So that's, following the money is always a good way to understand better who is behind these propositions. I'm not seeing any other questions. Nothing's popping up. Okay, so
there is one. It's who is on the committee. That's probably was answered in the previous question.
That's what I was thinking.
Okay.
Okay, so Linda, you want to finish off here?
Okay. Let's see. I have to start a share screen.
No, I can do them for you.
Oh, you want to do it? Okay.
Yeah, I'll do it for you.
Fine. Good. All right. 7 ballot measures. Fortunately, this year it's only 7 and not 13 like it was 2 years ago. We would like to know if there are any more questions on any of the propositions. Please raise your paw or ask your question in the Q&A.
And I'll go ahead and monitor the Q&A while you're going through these last few slides.
Okay. So there are lots of resources if you really want to get into the weeds, and our presentations undoubtedly have raised more questions than we have answers for. But there are really good sites, the California State Voter Guide, which you got in the mail, the Cal Matters website, which really covers a lot of these things, Ballotpedia, we've mentioned that several times, and the Easy Voter Guide from the League of Women Voters is pretty good too. Next slide. So the Voter's Edge is from the League of Women Voters, and you can learn all about the candidates on your ballots. So we've just discussed the ballot measures, but now these are the candidates. And next slide. Let's be aware that there are some key dates for this year's general election. I've received my ballot. I got mine on Tuesday. They were mailed out over the weekend. So look at that. Don't toss it away. And then remember to sign your ballot before you return it per the instructions. Otherwise, it won't be valid. October 28th is the last date to register and get a non-provisional ballot. You can also register up to vote to the day before November 8th, but you will get a provisional ballot. You can also at a vote center register to vote, but you will be voting provisionally. And what that really means is that the workers who determine whether a ballot is valid or not will have to check the signature and check the residence on the provisional ballot. So that has to be done before the ballot is counted. Next, as you know, in San Mateo County, we are a voter's choice county. So you have several ways to cast your ballots. One is by returning your ballot in the mail in the envelope provided, and note that you do not need a stamp, you just need a mailbox. There are drop boxes located all around the county. If you go to smcvotes.org, you can find out the location of those drop boxes, or you can go to this County Election Center at 40 Tower Road in San Mateo. You can also track your ballot. And I found this very interesting at the last election. You sign up for that at the California ballottracks.net/voter. And you will, they will tell you by email that your ballot has been received. They will tell you when it's processed, and they will tell you when it's tabulated. So that's really nice to know.
And I'll interject here. They'll also, if you agree, they'll send you a text with that
Yes.
information. It's really slick.
So on behalf of Kathy and myself, I want to thank you for spending time with us to learn about the state ballot measures.
All righty. Thank you, Kathy and Linda, for all the hard work you've presented us all. And I know we all have left with some questions, but this is a beginning to some of the research that we will be doing in the future. Just know that Thrive will be following up with all the materials provided, so you don't have to worry about jotting any of this down. Thank you so much to the Thrive team and everyone else that attended. We hope to see you at our next programs.